So, electrotherapy in the textbook encompasses 4 chapters, chapter 11, 12, 13, and 14. So chapter 11 is the introductory chapter, and then chapter 12 talks about muscle stim. Chapter 13 talks about applications for pain management. And chapter 14 talks a little bit about iontophoresis, which we will go over. And then there's a lot of information about wound care, and we are not going to cover wound care in this course. You will have a section in wound care in your special topics course next year, but we'll just cover a little bit of chapter 14. So I've tried to divide it up into smaller chunks, like I like to do. So basically in this section we are going to talk about terminology. Like ultrasound, electrical stim has a lot of terminology that's specific to electrical stim. In chapter 11, starting on page 234, there is a glossary, and we will go over some of the most of the terms in the glossary, not necessarily all of them, but it's nice to be familiar with them while you're reading through the chapters because they will come up. And we'll talk about electrical current devices and waveforms. So the learning objectives for this section, I want you to be able to define charge, current, conductivity, polarity, voltage, impedance, and motor point. I want you to just be able to state Ohm's law and its application to current flow. I want you to be able to define and describe the waveforms that are discussed in this lecture, and we're going to talk about 3, direct current, alternating current, and pulsatile current, which are the types that are used in electrotherapy. So the first part of the chapter, the first page, has some history of e-stim. It talks about sort of what was developed in the 19th and early 20th centuries. There is some recorded history of a Mesopotamian healer in about 400 who used electrical currents to produce transient pain relief, either by directly applying electrical torpedo fish to the human body or by placing a painful extremity into a pool of water containing the torpedo fish. And the resulting electrical shock stunned the nervous system and allowed for some relief of pain and some residual numbness in the extremity. So it's sort of been around for a while, the idea of electrical stim as therapy, but it didn't really begin to fully be developed until a little more recently. So we're going to talk about motor points. So Duchenne was a French neurologist who defined motor points, sort of mapped out where the electrical stimulation was most effective to cause muscles to contract. So a lot of the effect that we want to get with electrical stim, sometimes we want to be on a motor point, sometimes we do not want to be on a motor point. So these are the types of devices that are used in the clinic. Like all modalities, electrical stim goes in and out of favor. There are now even more opportunities for people to use them in the home setting. It used to be that in order to get a TENS unit, you had to have a doctor's prescription, and then it was dispensed by a physical therapist or a physical therapist assistant. And now you can just go down to Walgreens and get a TENS unit or buy one on Amazon. So that has changed a lot over the last 5 or 6 years. And most, like a TENS device, most insurances don't really even reimburse for that anymore. The good thing about that is that the cost has come down considerably. It used to be $400 or $500 for a TENS unit, and now you can get one for about $20. So huge reduction in cost. The only sort of the bad side of the coin, if you want to think of it that way, is people can read about precautions and everything, but whether or not they follow them, that is another thing. The unit on the left there is something more like what we'd see in the clinic for electrical stim, and we will have things like that in the lab, both TENS and the other units for you to practice with. So motor points are locations on the skin where the electrical stimulation most effectively causes specific muscles to contract. So if you are looking for a muscle contraction, you're doing electrical stim for muscle strengthening, you want to be on a motor point. If you don't want a motor contraction, you're doing it for some other reason, then you want to be off a motor point. And of course they're going to be different on different people. Generally it's close to the belly of the muscle. It's you're close to the neuromuscular junction where the nerve comes into the muscle. And so you're going to get a more effective muscle contraction. But usually in the clinic we find them by, we kind of have a general idea where the middle of the muscle belly is, and sometimes you have to move electrodes to get the effect that you want. The clinical applications of electrical currents in rehabilitation include producing muscle contractions, controlling pain, promoting tissue healing, transdermal drug delivery, and that's the iontophoresis application, and providing electromyographic biofeedback. So biofeedback, there's a separate chapter on that, and we will not be covering that in this class either, but it is a use for electrical stim. So electrical current is a flow of charged particles. So the speed of the electron flow is measured in amperes. Therapeutic current flow is usually in milliamps or microamps. So it's 1,000th of an ampere or a millionth of an ampere. So pretty small current flows. And you can think of the flow of current as being analogous to the flow of water. And we'll talk about some different things where that is helpful to think about it that way. So charge is an excess or deficiency of electrons, and of course we know that electrical charge in the body is carried in ions, sodium, potassium chloride. When we talked about fluid and electrolyte balance, that's our electrolyte's job in there, is to carry the charge in our body. Charge is expressed in units of coulombs, which is essentially the quantity of electrical charge. Any substance that allows the passage of charged particles is considered electrically conductive, or it's a conductor. Things that do not allow the flow of charged particles is electrically an insulator. So in our body we have things that are insulators, things that are conductors. Voltage is stored charge, and voltage drives current flow. You can think of it as being analogous to a water spigot controlling water flow. So higher voltage, the spigot is on more, you get more flow. Lower voltage, the spigot is off more, you get less flow. So materials that have the ability to propagate current are conductive. So if it has conductivity, then you can propagate current through it. If it's an insulator, then you can't. Polarity is the property of having two oppositely charged conductors. The positive conductor is the anode and the negative is the cathode. In a conductor, free electrons move from negative to positive. So the movement of charge, that's what we're looking for, and it's electrons that are carrying that charge. So resistance is the opposition to the flow of charged particles. So a larger cross-section of conductor has less resistance. A smaller cross-section has more resistance. Resistance increases as the length of the conductor increases. So Ohm's law is that current is directly proportional to voltage. So more voltage, more current. That goes with that water spigot. It's indirectly proportional to resistance, so more resistance, less current. And so the equation, which I'm not going to expect you to write out or anything, but it's current equals voltage over resistance, or voltage equals current times resistance. So I just want you to know their relationship. Current directly proportional to voltage and indirectly proportional to resistance. Capacitance is the ability to store charge in an electric field and to oppose change in current flow. So usually when you have a capacitor, it's two conductors separated by an insulator. So our cells, our body systems are capacitors. Our cells themselves, they have that phospholipid membrane. That's fat. It's an insulator. And then the inside is charged and the outside is charged. So it's that insulator separating two conductors. So if there were no insulators, if the everything was just floating around, it would eventually come to equilibrium and you wouldn't store any charge. You wouldn't have any potential chemical energy. So the electrodes that we use on people's skin and nerves are conductors. Skin and fat are insulators. So impedance is the biological term for resistance. So impedance is opposition to current flow in biologic tissues, and it's frequency dependent. So the combination of resistance and capacitance in our tissues is impedance, and it's measured in ohms. So muscle and body water are conductors. The electricity flows easily. Resistance is low, impedance is low. Fat and skin are insulators. The electricity does not flow, so the resistance is high and impedance is high. So those body fat scales where you step on it and it measures your body fat, they do it by impedance. So they're telling how fast or what rate the electricity is running through your body. So if you have more fat, it's going to be slower. If you have less fat, it's going to be faster. A waveform is the shape or visual representation of an electric current. The actual waveform that enters the patient through the electrodes depends on the resistive properties of tissues, and so it's going to change the shape of the waveform. But we're basically talking about waveforms as just a way to visualize the different types of currents that we are using. So I said before, direct current, alternating current, and pulsatile current are the three that we use therapeutically. So direct current is a continuous unidirectional flow of charged particles. One electrode remains positive and one remains negative. And your current flow is going to depend on the polarity set on the machine. So we mostly use it for iontophoresis, for stimulating denervated muscles, which doesn't come up all that often, and for wound healing. So in wound healing, we're trying to get charged particles to move from one place to another. In iontophoresis, we're doing the same thing, but we're doing transdermal delivery of charged medications, usually anti-inflammatories. So in direct current, there is a net charge. There's accumulation of charge underneath the electrodes, and so it can be more uncomfortable than the other types of current. And so there's also more potential for burns, so it's a little more dangerous. Alternating current is a continuous, uninterrupted bidirectional flow of charged particles. The polarity continually reverses between the electrodes, so there's no net chemical buildup in tissues due to changing current. So we will talk about in the pain chapter and in the muscle chapter some different applications of alternating current. Pulsatile current is either unidirectional or bidirectional, and there are periodic interruptions in the current flow. So just like pulsed ultrasound that we talked about, this is pulsed electrical stim. And it's a common type of current that's used in e-stim applications. It can be monophasic or biphasic. So monophasic, there's one phase to each pulse. So the phase represents a current flow in one direction for a finite period of time. So that's that on time, pulse, pulse, pulse. The negative, the flow in monophasic current can be negative or positive. With biphasic current, there are two phases for each pulse. So there's a negative and a positive. So it's a more balanced flow. There are lots of different types of pulsatile current, and we're not going to worry too much about asymmetrical versus symmetrical. Those are actually set up on the device that we use. So you don't have to choose whether you're going to be balanced or unbalanced or symmetrical or asymmetrical. The device you use determines that. So alternating current is always biphasic. Most alternating current applications are sinusoidal and symmetrical, and they tend to be more comfortable.